Hi, I'm Alison, an occupational therapist working in Powys. As an occupational therapist, our role is to support people while they adapt to changes in their lives, manage their condition, and optimise the day-to-day activities. One area we see a lot of in the adult population is arthritic conditions, and this often affects their hands. Living with arthritis means maybe having pain day in, day out. Arthritis affects all aspects of life, from the tasks we take for granted, like dressing or turning a car key, to our role in our family or our employment. A holistic functional assessment by an occupational therapist can enable people to optimise their lives while they're living with arthritis. Making an assessment of a person's hands starts the moment they arrive in the department, observing how they use their hands, signs of pains, and their body language. We then discuss with the patient their feelings and needs, and how their condition is interfering with what matters to them and what they want to do. This enables the occupational therapist to get to know the individual, learn about the person's roles and lifestyles, and how they've been coping with their condition. This is an objective assessment and helps us plan treatment and the long-term management. The other objective assessments are observing the hand, the appearance, noting the pain, the quality and pattern of sleep, and their energy levels. Their functional goal plan will then include techniques to address these. There are aspects that the occupational therapist can measure. These include seeing how much the joints move, their power of the hand, sensation. The thumb joint is often problematic, and that's not surprising as it's usually used in most grips. There are some functional assessments that measure the quality and the timing element of completing specific tasks, and these cover a whole range of activities including sport and work. Once the information from the assessment has been gathered, the occupational therapist would offer what we call evidence-based plan, i.e. using the techniques and treatments that work. We would explain the reasons for each option and together agree with the patient the next steps. The overall goal is to address the task or role aspect of employment that was problematic to the individual. Some options we use include explaining how tasks and grips can be changed and altered, using strength-based approach to changing habits, recommend gadgets, recommend exercises, use maybe some supportive splints. The sessions are usually completed in the occupational therapy department at an appropriate frequency, and finishing with a review, comparing our findings at the beginning to that time of their treatment. For the last couple of years, people in Powys have been able to see their rheumatologist in Powys, and the occupational therapy service has been able to mirror this and usually offer an assessment in their local hospital. Access to this rheumatology hand therapy service is currently via a written letter from the consultant or specialist nurse. And we're hoping to open this method of referral to other ways, GPs and maybe self-referrals.